This is our life science panel, and I'll introduce you to our panelists in just a moment. When I was asked to moderate this panel, I was reminded, of course, in my role, I cover a lot of science for the Globe and Mail, including life sciences. I was reminded this is not going to be a life science specific audience, and I thought, where is there not a life science specific audience anymore? Here's my proof of this. Here's something I bet you didn't know back before 2020. Here's your little exam. What is more desirable, R naught greater than 1 or R naught below 1? I bet you didn't know the answer to that in 2019. How about this? Antibody test, PCR test. Which one tells you if you have COVID? Which one tells you if you had COVID? See? Hands up if you got 100%. There you go. So, and if I ask you another question, I have to give out diplomas. So I'm going to stop there. Anyway, the point is we all know a heck of a lot more about life science than we did a few years ago in ways perhaps we didn't expect, because the pandemic has kind of revealed in a way our entire system from soup to nuts, and research, innovation, regulation, procurement, public health, delivery, you name it. Every aspect of what we think of as our health system came into play and is still in play. And there is quite a bit to be learned from what we have experienced and witnessed over the last couple of years. So with that in mind, I'd like to welcome our two panelists today, just with a quick introduction to give their perspectives on what's come out of this for life sciences from a strategic point of view, from a growth point of view, from a policy point of view. First, Rob Annan. Immediately to my left, Rob Annan is science. He is president and CEO of Genome Canada. For those who don't know Rob, he leads Genome Canada's team and is responsible for developing and leading the organization's overall strategic direction. An innovation strategist and skilled communicator, Rob works closely with business leaders, policymakers, and researchers, inspiring a shared effort to translate research into impact. So he's sort of that gap between the science and the implementation. Prior to joining Genome Canada, Rob helped build Canadian. Rob was involved with MedTech in his executive leadership. And was also on the board of Let's Talk Science and spent several years as a fellow of the Public Policy Forum. Rob also has a background both in English and biology, so how he's not a science journalist is a mystery. At the far left, my far left, your far right, James Brodie is an executive leader in the Canadian healthcare industry for nearly 25 years. He's held senior roles across the medical devices, medical technology, and pharmaceutical division of Johnson & Johnson. Currently, James is general manager of Johnson & Johnson MedTech, that's JJMT for short, here in Canada, in surgery, orthopedics, and interventional solutions. Those are sort of, that's the remit of JJMT. In his role, he oversees setting and delivering the strategic priorities and profitability for the 5 JJMT businesses within Canada, including Ethicon, Depuis Synthes, Biosense Webster, Cerenovus, and Mentor. He's a member of the JJMT North American Commercial Council and chair of the JJMT Canadian Leadership Team. Importantly, for this panel, he sits on the board of directors of MedTech Canada, the national association representing the medical technology industry in Canada. So please join me in welcoming Rob and James to our conversation. Thanks very much, guys. So I would like to start with a question. I'm hoping that you will also have questions for our panelists. This is really the time, I think, to focus on how health, science, and innovation and delivery plays into growth and some of the other strategic issues that are being discussed at this forum. And I think we now have some, as I said earlier, some sense of this perhaps because of the pandemic more than we've ever had. I have a couple of questions for our panelists, but I'm also going to encourage you to ask questions, which you can do on your cell phone. Those questions will pop up on the screen. So in the latter half of our panel, we can go to that as well. We've got about 15 minutes or so. So you came all this way. Why not ask a question? My question first to the panelists is, I think, the one you would expect. We have all learned a lot in the last 2 years. We've observed things and seen things that perhaps surprised us. We've learned things about how from our households to our communities to our workspaces to the country, we've seen how health intersects with our daily lives and what has worked and what has not worked so well through the pandemic. What I thought I would ask our panelists first, each of you, Rob and James, is to start off by reflecting on what you observed during the last 2 years of the pandemic. This was kind of the stress test for our system across the board. What did you see happen during that stress test? What did you observe that was instructive? Perhaps things where change is needed, perhaps opportunities as well. Rob, we'll start with you.
Sure, thanks, Ivan, and thanks to PPF for this event. It's great to be here. So I think one of the big takeaway for me is that we live in a marvelous time, and thank goodness for science. What we really did see with COVID was a rapid response around the world of kind of scientific mobilization, both in the universities, in the public sector, government science, as well as in industry, that produced unbelievable results. And I think the vaccine development is clearly kind of a flagship example of that, just unbelievably quick and effective, but also a whole range of other areas. Here in Canada, we were involved very early in the response in something called the Canadian COVID-19 Genomics Network. It was really designed to plug into international efforts to do viral surveillance. So this is really tracking viral transmission and the evolution of the virus and the emergence of all of these variants we've unfortunately become so familiar with. It was really a grassroots effort that was really driven by university researchers, public health researchers who saw the need and the opportunity to apply what they knew, the knowledge they had, the tools they had, the technologies, the teams they had to contribute to the understanding that would be necessary to really confront the challenges of the pandemic. It's a testament to how strong our research community is, both in Canada and globally. We have phenomenal universities. We've got great talent, both at the kind of the researcher level, but also the student level. And that we were able to mobilize very, very rapidly. But I think the thing that we have to keep in mind is that rapid response was really 20 years or more in the making. That you don't just turn this overnight, that it's actually the sustained kind of support and investment over time that gives you the capacity to be able to respond when necessary. And when the need was there, the community really did come together, and because of the shared purpose, was able to overcome some of the real challenges that exist to sort of in a shared purpose across sector lines, institutional lines, and so on.
Got it. I'm going to ask you more about those challenges, but first let's go to James from the industry perspective. And of course, the observations needn't only be about infectious disease and COVID, but what happened across the whole sector.
Right. No, appreciate it. Thanks to PPF as well. I have to start. I can't not start with this. I was looking for the life science partners backstage, and we're the ones huddled behind our masks still. But at any rate, pleasure to be here. I think, first of all, representing Johnson & Johnson, the broader life sciences industry, was really proud to be a part of, the tip of the spear, so to speak, in terms of managing the front end of the pandemic with things like PPE, ventilators, et cetera, all the things that Canada and globally around the world people were scrambling for, right through to the obvious examples of therapeutics and certainly vaccines, as Minister Champagne just mentioned, the fact that a vaccine and several vaccines were researched, developed, manufactured, and executed within 12 months versus a decade. So certainly the industry at large enjoyed that. One of the biggest things we saw from a macro perspective through all of that was a resurgence from policymakers and politicians alike, governments alike around the world, around the importance of life sciences as a sector. I think I hope we can all agree that it certainly helped us through the pandemic and continues to help us today. But I think, as opposed to thinking about the life sciences, particularly in a universally funded healthcare system like Canada, as health as a cost to be managed, governments are really looking at health as not only an investment and a growth driver now, as evidenced by many life sciences strategies, but also even a matter of national security as well. So I don't want to overstep that claim, but certainly some governments are looking at it through that lens as well. And I think to frame the discussion, I reflect back on what's happened in the last couple of years through lots of policy discussions, forums such as this, and I frame it in the old adage of the movie, The Good, the Bad, and the Ugly, right? So on the good side, I don't think anybody can argue that on any measure, the federal and provincial and territorial governments did an outstanding job in terms of cases, mortality, vaccination rates, et cetera, in terms of managing the pandemic from a public health perspective. We all have debates as to what could have been done better. We have to learn, but certainly on a global stage, phenomenal. I think the other big thing that we did well, the good, was really around this move to digital or virtual care. We've been talking about virtual medical care for decades now, and in the span of 6 weeks, through very simple incentives and rules and guidelines, the entire industry has moved to that. 80+% of healthcare visits now virtual. Patients are loving it, clinicians are loving it as well. I think on the bad side of things, look no further than a recent Health Canada analysis that said that 700,000 plus surgical procedures have been deferred. These are not elective, which is a bad word for what's going on out there. These are all required urgent surgeries out there, cancer, orthopedic surgeries, et cetera, cardiac. And you've got close to 1 million patients now out there who are waiting for their care, and double that if you take into account diagnostics, which might have the downstream consequence of individuals deferring or delaying cancer diagnoses, as one example. So that's a big bad. I think another bad was just lack of digital integration across the system. Industry needed to get well-timed data to help ramp up with surgical procedures, and unfortunately, we're just not equipped in terms of government and industry partnerships yet to make that happen. I think the ugly is, and there's probably a lot of people in this room who represent these industries, where the unintended consequences economically of certain industries like travel, hospitality, et cetera. I wouldn't want to be in government's shoes about making those trade-off decisions because they did a phenomenal job on the public health side of things. But obviously some industries were disproportionately impacted, and we have to learn from that as well.
Excellent. Thank you very much for both of those overviews. I want to focus on 2 quick things for each of you. Picking up on what you said, especially the word integration and coordination as well. Rob, I know one of the challenges, without genomic surveillance, we know that we wouldn't know about the variants, we wouldn't be able to anticipate new surges of the pandemic. That was extremely important, and I'm sure has changed how we will face infectious disease in the future. But coordination wasn't easy, and data sharing is an issue. Why don't you tell us a little bit about what was learned on that side of things?
How much time do we have?
Brief.
Yeah, so I think one of the big challenges that we saw in the pandemic, and it was certainly true in the genomic space, but I think writ large, was a real fragmentation. And that fragmentation during sort of peacetime is a problem, but there are workarounds, even if they're cumbersome and challenging and so on. But in a crisis situation like the pandemic, that fragmentation becomes a real problem. And certainly the pace was...
I'm just going to give an example so people know what we're talking about. For example, you would want to know potentially if you're a researcher and you're trying to analyze the state of the pandemic, if new cases are showing up in a particular area, a new variant, for example, is it showing up in people who are or are not vaccinated? And this was not easy information to get.
No, it was not. But there's layers to that. So for example, in terms of the viral surveillance project, for instance, this was a global effort, and really what involved was all the PCR tests that people were doing and so on. We're actually generating this. We're not going to do a genomics lesson, don't worry, but we're generating sequences that allowed us to sort of track mutations that would occur, and then determine whether or not there were new variants that contained those same mutations over and over again, spreading through the population. And you may have seen in some of the great science reporting, for instance, from Ivan and others, kind of some of these like family tree type diagrams that show the emergence of Delta, that show the emergence of Omicron, and so on. It was really important to be able to share that data up the chain, as it were, in order to be able to make public health decisions. So in Canada, our health systems are managed at the provincial level, and so that data at the provincial level was being generated under serious duress. I don't mean to sort of disparage anyone's work here, because it was a lot of effort under very difficult conditions, and so that data was getting to the provincial level and helping inform inform provincial decision makers. We needed that data to then roll up to the national level so that we could get a good national picture. And then that data needed to be shared publicly in international databases so that we could watch what was happening around the world. And our systems are just not well equipped, or were not well equipped, to do all of that sort of sharing. And it was because of some sort of maybe antiquated approaches to, for instance, kind of the technical side of things, we could solve those pretty easily. There were some issues around policy and legal issues. Again, pretty easy to solve, but it was really around capacity and culture in terms of actually like getting data and moving it through the system that became a real problem. So we generated the data certainly in Canada, and it did inform public health decision making, but from a research perspective, it was frustrating because that ability to really roll it out into the public sphere where it would be useful for drug development, where it would be useful for international tracking and so on, was a real challenge. So that fragmentation continues. There are workarounds. There are committees working on this to this day, but that is actually kind of a persistent challenge for us going forward.
Got it. And James, like 2 words jump to mind: supply chain, right? Among many other things that I'm sure affected the industry, and also, you know, sort of this coordination of all the different levels. From your point of view, like on the material side, on the or even on the therapeutic side, you know, what were the challenges?
Well, it's interesting. I've been here all day really enjoying all the different topics well outside of my field of expertise, and those 2 words came up in every session so far: supply chain. It was in food and agri, it was in energy, et cetera. And one of the challenges we saw early on is, like, we've espoused the benefits of globalization and open economies and all these great trade agreements we have. Well, it took a pretty big, massive crisis, a pandemic, to have people revert to old ways, right? In terms of protectionism around things like N95 masks, vaccines, et cetera. And so that showed a risk, especially to an economy the size of Canada's, as Minister Champagne said. Like, we have to be integrated into the global supply chain in healthcare, but in every other sense of the word, for us to survive in this global community based on scale. You know, some of the issues, N95 mask, the former president of the United States tried to eliminate the distribution of N95 masks out of the US until he was educated on the fact that many parts of those N95 masks, the filters, et cetera, are produced in Canada. So, okay, it's really difficult then to withhold this because your supply is going to be truncated, right? Vaccine would be another good example of that. And this morning, Ambassador Campbell talked a little bit about interoperability, which I think is another word for this global supply chain integration. And I think what Canada needs to do is, we can't be self-sufficient. No country can, other than maybe US or China, but we can't really be self-sufficient on the scale. So we need to be strategic about the areas that we're going to choose. And I'll speak for life sciences. Things like bringing mRNA production into Canada, fill and finish was just discussed in Canada as well. And recently, totally coincidentally, Johnson & Johnson just established a partnership with the Ontario government in Guelph for our Tylenol manufacturing plant. Modest investment from the Ontario government, big scale up from J&J, and we're now going to become a global hub for Tylenol. Tylenol, as you know, was critical, not as important as vaccines and others, but critical through the pandemic in terms of managing the signs and symptoms of COVID-19. Now, all of a sudden, you've got Canada, you know, fighting above our weight class in a critical health or life science product, Tylenol, such that when there are conversations diplomatically happening around things like vaccine production and distribution, we have a chip to play. A small example, coincidentally happened this week that we're proud of, but there are lots of other examples where we can work with our G20 colleagues to be more integrated with the global supply chain.
Excellent. People have responded with questions, so I want to make good on the promise. Here's one that I think both of you could speak to. How can learning from the pandemic on digital health, I think both of you have a digital side to what you're doing, how can it inform our service delivery in remote locations, and in particular Indigenous communities? You know, can this trend that we've seen spread out?
Do you want to tackle that?
Yeah, I could tackle that, sure. On the healthcare delivery side, so as I mentioned, virtual connectivity in health has been probably one of the biggest benefits that happened through the entire pandemic, right? And we've learned, you know, not only the process around it, but how to do it, the value of it, but how to do it. And I think of things like digital apps that, you know, everybody's got a smartphone, including in northern and remote communities. They're allowing, in my world, surgical procedures. So doing what we call prehab, so the prehabilitation work to get yourself ready for a surgical procedure. That can and should happen remotely. There's no reason you have to come into a large urban center to do that kind of work. You can and should be able to do that remotely in anywhere across Canada or the world. Certainly you have to come to an acute center to have a major procedure, although we could debate that maybe later on today as well, because that was part of the problem of patients being held hostage, this homogenous acute system where everything was funneled through these complex hospitals. But then post-surgery as well, using digital technology to watch people's infection control, watch their wound management, all these types of things. You can manage end-to-end the patient episode through digital or virtual care. Really the only thing that has to happen in an acute setting is the procedure itself. So one tangible example of what we can do around that. I think another tangible example in MedTech is the immersion of digitally assisted robotic surgery. Okay, so surgeries, very complex. People study 20 years and practice 20 years to do these types of things around the world. But the reality is with the advances in technology and algorithms, et cetera, you can have people doing surgeries in a place like the UHN in Toronto, but the robot is actually performing the surgery anywhere around the world. That's not too far off in the distance, right? So that's already being tested in battlefields from a war perspective. You can understand keeping the surgeons safe and away from the theater of war, but it's something that will become applicable in the health industry as well in the not too distant future.
Got it.
You know, I might pick up on this from a slightly different angle. Of course, we're not involved in service delivery at Genome Canada, but I think there's something really interesting. So we do have a project I didn't talk about looking at, you know, sort of the human response to COVID-19 and really looking at kind of the human 10,000 individual genomes in Canada to understand the genetic linkages between kind of disease severity and so on. That gets to kind of a bigger issue around precision health more generally and the ability to really use a lot of these new technologies and these new tools. Right now, they tend to be focused in urban centers. And that's you know, because that's where a lot of the R&D is happening, that's where the research is happening, and so on. It's going to be more and more, you know, it's going to be easier and easier to actually take those out into remote communities. But it starts to open up really, I think, important questions around, you know, data governance and privacy and who has control over the data that's, you know, related to their own health. When it comes to your genomic data, there's nothing more intimate than the data that's in your genome. And so, how do we make sure that we address some of these issues around, especially when it comes to Indigenous communities, for instance, kind of governance that respects the individual, but still allows us to be able to kind of work in a collective manner. And these, I think, underline an important issue that we saw all the way through the pandemic, which is that science is amazing and science is important, but science still intersects with society. And these are not scientific questions, these are social questions. And you know, the social sciences have a lot to teach us about that, but it really is a collective effort. It's not up to the scientists, the clinicians, and so on to decide these things. It's up to all of us to make sure that we're holding both science to account, but also making sure that it's equitably shared.
Got it. One more question for each of you from the audience. You know, James, you were just talking about that initiative in Guelph, and there's a question here about how do mid-sized cities in Canada look to grow a role in the life sciences and become more attractive to companies in the space. So I'm sure Guelph is maybe one example of that, but maybe you can comment on, like, what are the necessary conditions for that thing to happen, and how, you know, how can this be a development opportunity, not just in the major centers?
Mm-hmm. It's a good question, and I think one of the things, you know, I started this by saying that, you know, governments, policymakers have woken up to the value and importance, obviously, of life sciences, and you're seeing governments like the feds first, and then Ontario very recently, Quebec and others following suit with fairly robust life sciences strategy, and it's an open topic of discussion right now. And I think, you know, in Ontario, for example, they're talking a lot about venture capital, trying to double venture capital into the province in the next number of years, but also helping small to mid-sized startups. So first of all, it comes from government putting an emphasis on the sector in general, right? And really pleased to see that that is starting to happen. And so in terms of small and medium-sized cities, tapping into all of those things is critical, although it's kind of like I work for a large multinational organization and human resource systems. I mean, you don't know where to go for things, right? Same thing with government, right? There's, Minister Champagne mentioned, there's just, it gets confusing. You know, there's so many programs out there, where do you tap into the resources? So I think that's something executionally that needs to be looked at. I think the bigger opportunity, though, that is not currently captured in the life sciences strategies provincially or federally is just creating an environment that values the adoption of new technology. That's going to help everybody, not just small and medium-sized enterprises in small and medium-sized cities, but multinationals and just patients and consumers in general. For too long, as I said at the outset, you know, health has been seen as an expense and a cost to manage. And our new federal Minister of Health, Minister Duclos, is quoted as saying this. He now views health as an investment in our future. right? An economic driver. And so what we have to do at the federal, but more importantly at the provincial level, given our federation status and the fact that health is managed at a provincial and territorial level, we need to create an environment that values the adoption of that innovation. Yes, for the advance of patient outcomes that it promises, but to create this virtuous cycle of not only patient outcomes, but then adoption of new technology in terms of economic growth. And then all of a sudden you're gonna get talent coming into Canada, small and medium-sized companies, VC coming into Canada, and ultimately, like me, large multinational enterprises putting money into Canada for a Tylenol plant in Guelph. It creates this virtuous cycle, but it kind of all starts with that ecosystem and that environment of valuing innovation.
Thanks for that. Thanks for connecting all those threads. And Rob, one more question to you as well. You know, when we think about genomics, we've already talked about this is the world of the time of big data, which also means big computation. So looking to the future, we have another question from the audience. Can you expand on the growth and opportunities between AI and health? And of course, we know there are, you know, AI strategies and other things at play from the federal government. How does, what's your observation on that future?
Yeah, thanks. This is a super timely question. I mean, it's a fascinating time in what we do, right? So genomics really is sort of digital biology, right? It's about certainly DNA sequences, but also other information, sort of data coming out of the molecular life sciences. And it's just, I cannot even begin to tell you how much data comes out of this stuff. I mean, it's enormous amounts of data, and it's fascinating. But until even just a few years ago, we did not have the capacity really to handle that kind of data, or really to do kind of sophisticated analysis. And there's a lot of information in there. A lot of us are maybe more familiar with, kind of genetics. When we think about, we have a gene for something, right? You know, there's the cystic fibrosis gene that was sequenced here in Toronto, actually, that, is related to cystic fibrosis. But oftentimes we have these multigenic traits, so they're very complicated. We are complicated animals, and teasing out the information from our genomes is increasingly possible thanks to advances in AI. So I really do think we have a confluence right now of almost a perfect storm of our ability to generate enormous amounts of data that allows each one of us to be able to actually start to get more detailed and personal information about what's going on with our health, the ability to actually manage that data and analyze that data, and then act on that data. And I think it's going to just absolutely revolutionize and transform the healthcare sector over the next 10 to 20 years.
It's great, and a great note to end out. I want to finish off with just an observation and one more quick question for each of you. Thank you also to the audience for your terrific questions, which have prompted these discussions. So just as a sense of how far we've come, maybe we haven't, in a way that maybe people aren't even aware of the scale of the transformation. 19 years ago this month was the announcement of the completion of the Human Genome Project, like a 10-year effort, multi-billion-dollar effort to sequence the genome of a person. And now we look at how easily and how frequently that occurs. That same month, 19 years ago, the world was facing WHO warnings from the SARS crisis. At the time, it wasn't clear how those two were going to link up. Now it's impossible not to think about a pandemic and genomics at the same time, along with many other areas of health. Now, out of the SARS crisis, we learned a lot, and we forgot a lot. One of the things that came out of it was the Public Health Agency of Canada, for example, here in Canada. If we go forward 19 years or 20 years, what should be the legacy of this pandemic? What do you think?
So I think, it's a great analogy when you think back to the first SARS, which, by the way, was sequenced in Vancouver, the very first example of the virus being sequenced back then. But really, I think it's an illustrative case when we think about the Public Health Agency of Canada, because it was created in the shadow of the first SARS epidemic. But it, and with all due respect, it wasn't ready for this next pandemic. And that is a collective responsibility. There were certainly people at the Public Health Agency of Canada saying we need to do more to get ready. But, collectively, I think as a society, we weren't investing in the preparation for what was coming next, for the next crisis. So I think that coming out of this, we need to, all of us need to make sure that we are committed to making, to keeping the gains that have been made. We've built really important infrastructure, both hard infrastructure and soft infrastructure, that will help us deal with the next pandemic. There will be more. All of that infrastructure can be used to useful purpose between pandemics and other ways and so on. We also have to learn that we need to make sure that we're ready for other crises. I mean, the climate crisis crisis, for instance, is unfolding slowly in front of us, but it is just as important in terms of overall global health and other potential social impacts, but also things like antimicrobial resistance and so on. So there's a lot of really big challenges that we're facing right now, and we need to make sure that we're putting the time and energy and resources into being ready for those. And it gets back to my earlier point, which is that you can't just turn on the taps when the crisis hits, when it comes to the R&D that provide us the tools to be able to respond. We need to make sure that we are investing sustainably in a lot of these sorts of things. And that includes not just the hard sciences, but the social sciences to help us understand, for instance, why we saw this rise in vaccine hesitancy and why a rise in the politicization of mask wearing and a lot of the social difficulties we're facing that will help us navigate these other challenges going forward. So it's not just up to the scientists. I think it really is like a collective social responsibility.
Great point. James, last word from industry. What should be the legacy?
Yeah, I mean, I've spoken a little bit about the fact that life sciences strategies are emerging and in the public consciousness now of government, but also society in general, which is great. I think the big thing, though, is just this notion of collaboration. We couldn't have managed through this pandemic. I'm not saying it's over, but the early stages of the pandemic without private industry, vaccines, therapeutics, PPE, government, Public Health Agency of Canada, and citizens, mask wearing, et cetera, social distancing, all working exceptionally together. And you know what, we've known this. Senator Peter Harder wrote a report, and one of the things that he talked about was this notion of a grand alliance, which is exactly what we've just seen coming through the pandemic. Canadians fared so well, as I said at the outset, because we all work together. And I think for a life sciences strategy to really work and sing from, yes, a public health perspective, an economic, and even a global security perspective, all partners need to be at the table to establish how we're going to manage the challenges of the day, a globally integrated supply chain, tackling 1 million deferred and delayed surgical procedures, 2 million diagnostics, et cetera. These are big challenges that we all have to work together to solve.
Got it. You heard it here first. Thank you very much to our panel, Rob Annan, James Brodie. We've got lots of work to do. Thank you very much for your questions, and I think away we go.
Awesome.